Welcome to Q&A practice. Let's get started with the plaintiff attorney. Ready? Here we go. The PCR report, the pre-hospital care report, who prepared that? I believe on this call, Bob Owens was the one who documented most of it, meaning he actually wrote in the information. Yes, would you have had any part in preparing this report or providing the information that was put into the report? Well, I provide all the information put into the report. Okay, what was your role that night? I was a patient man that evening. I responded to the call. I'm the one responsible for treating the patient. Any type of treatment that the patient receives is from me or delegated by me. And then my partner is the one documenting, and he was on the radio as well, calling it into the base hospital. Who would you delegate to if you were delegating? My EMTs that I'm working with, both Kevin, Joe, Jerry, and also the EMTs that show up on the ambulance. Do you, as you sit here today, do you have an independent recollection of this call, responding to it? Very brief. Okay, it might be easier if you just tell me what you remember, and then I'll go through and ask some more specific questions. Objection to the extent that it calls for a narrative response as phrased. You can answer, okay, sorry about that. I remember getting to the scene. I remember seeing a lady figure lying face down in the street, and it was near a bus stop, and implied by the call it was an auto versus pedestrian type call. And then the only other part of the actual call that I do remember is the smell of ETOH or alcohol on the patient. ETOH, yes, our abbreviation for alcohol smell. I don't exactly know what it stands for. Is there any other particular reason why that stands out in your mind? Is that a significant observation? It was a significant finding, yes, because it made it difficult for me to assess the patient. In what way did it make it difficult for you to assess her? I couldn't tell whether her injuries or the way she was acting was caused by the alcohol or by the accident itself. Is there any particular, when you say the way she was acting, was there anything particular about her behavior in particular that stands out in your mind when she was altered? In what way? In that she could not answer all my questions or respond to me appropriately as you and I are speaking right now, either based on what your own memory or based on what you may have documented or what was documented in the reports. Is there anything that you can tell me that she wasn't responding to appropriately, or what kind of questions she wasn't able to answer for you? She couldn't tell me the time of day, the place where she was, the situation, what had happened. Was there anything else about her behavior that's noted on the report or that you can recall that made it difficult for you to determine whether it was the effects of alcohol or the nature of the injury? She was combative, and had repetitive questioning the entire time. Do you have a recollection of what kind of questions she was asking? I don't know specific questions that she was asking. Do you remember in what way she was being combative, if you recall? No, I don't know specifically, other than some of these indications that we've just discussed, including her behavior and the fact that she couldn't answer questions. Was there anything else that you observed, or any, I'm not sure if I'm going to word this right, test that you conducted that would have led you to believe she was under the influence of alcohol? For example, the Pearl test. No, we don't perform tests to find out if they are under the influence of alcohol. Okay, the Pearl test down here, which is noted about halfway down the page on the left-hand side, pupils, and then beside it, the PERL. Did you conduct that part of the examination? Yes. And what would the purpose of doing that be? To check for some type of brain injury, and based on the results that are noted here, it looks like sluggish left and right was checked off and were at 6 millimeters, her pupils. What would that suggest, if anything, to you as a paramedic? It doesn't suggest anything to me. It's nothing conclusive, just a secondary finding that I found. Okay, and is this something that you do? And then it's not normal, though. It is not a normal finding. No. In your experience, could that be attributed to the use of alcohol? Objection. Vague and ambiguous, calls for the witness to speculate, lacks foundation, potentially calls for an expert opinion. If you know based on your training experience as a paramedic, calls for an improper lay opinion. Alcohol has in the past caused pupils to be sluggish. And the same question with respect to drugs, street drugs as opposed to any medications. Could they cause the same, or in your experience as a paramedic, have you noticed the same type of response, same objection as previously personally noted. Yes, drugs can also cause pupils to be sluggish. Is there anything else that, that kind of stands out in your mind about this incident that you remember? Objection: to the extent it calls for a narrative response as phrased. Nothing that stands out in my mind about the call specifically. Then I just want to go over your PCR report in a little bit more detail. Under the chief complaint, is that a triangle? Yes. And then LOC? Yes. And that stands for altered level of consciousness, and that finding was based upon some of the examinations that you performed on her? Yes. Okay, and I guess we've already covered a little bit of it. Part of that would be that she was only oriented times 1, meaning that what did she know? Who was she? Who she was? Yes. Okay, and as to the rest of the questions you asked her in that regard, the time of day, the place, the situation, she wasn't able to, no, respond correct. Okay, I'm sorry, no, you're actually doing really well. Just under that, it says history of illness, injury, patient hit by vehicle going approximately 40 miles per hour. Do you know where you got that information with respect to how, particularly with respect to how fast the vehicle was traveling? My partner got that information. I did not. Do you know where he got that information from? Usually either a bystander, the person that was in the vehicle told the story, or from the patient is where we find that information. Is it safe to say in this situation it wouldn't have come from the patient given her altered level of consciousness? Yes. Do you know whether there were any bystanders or witnesses around at the time that you were rendering your aid to the patient? I don't know. This question probably won't make sense since you don't know, but did you talk to anyone else at the scene other than the other people from the Orange County Fire Authority and possibly the Sheriff's Department and the ambulance and the EMTs from the ambulance? No. Would you have talked to the driver of the vehicle that struck the patients? I would not have. And if there had been witnesses around or bystanders, would it be your custom and practice to speak to any of them for any reason? Yes. And what reason would you usually speak to them? But it wouldn't be my role to do that. That would be my partner's role as the documenter and radio person. Okay, so that would be Robert Sherwood's role. Yes. Do you know if he in fact talked to anybody? I don't know. Is that something that would generally be documented anywhere on any of the 3 reports or forms that we have here today, just under the history, or if there's any comments down below, it would have been documented there as well. And the comments section is where the PQRST is on the right side of the form here, or the left side of the form, down in the middle where it says patient found laying face down in the middle of the street. Yes, patient, that's what's that right before LQC, patient, and then there's an S with a line through it, without loss of consciousness. Would that be, or that's what I interpret it as, but I didn't write it. Okay, is it typical that you would try to obtain a medical history if possible? And again, I'm looking back at the top 1/3 of the report. Yes. The PCR report. Yes. And since nothing is checked here, does that mean you weren't able to obtain it, or or she had no history? No, we were unable to obtain it. Okay. And again, that's because of her condition at the time, her state of mind, more than likely. And that was the same would be true of the section right beside that says meds unknown. Yes, so you wouldn't have strike that if she had been taking any prescription medications or anything like that. You would have noted it in that section if she had been able to tell you. Is that correct? Yes. Underneath that it says PMD. What does that stand for? Private medical doctor. Now if we go a little bit further down, I guess down and over to the left hand side, we've already touched briefly on the LOC section, and underneath that you've checked the ETOH odor, and that's something you personally noted, correct? Yes. And you noted that obviously from the patient and not anybody else around the scene, correct? Yes. Repetitive, that's checked under here, would refer to the repetitive questioning. Yes. And it says VIOL/COMB. Is that violent/combative? Yes. And you circled the combative section, correct? My partner did. Yes, your partner did. Okay, how is this report generally filled out? Is he sitting there with it and you're giving information, and then simultaneously while you're rendering aid he's completing the form, or is it done after the fact? This report was probably done that way. Not all reports are done the same. Depending on the level of treatment that the patient needs, my partner will help me treat the patient as well. If the patient doesn't need hardly any treatment at all, I will take the report and the radio with me in the ambulance, and he'll drive behind in the medic van and bring it to the hospital. On this call, he did ride with me in the ambulance, so he continued the documentation, continued the radio while I treated the patient. And who would have driven the van then? The engine company. Someone from engine 5 would have, yes, brought our van to the hospital to pick us up. Do you know if any other than yourself and Mr. Owens, was anyone else in the ambulance with you guys or the van? Any family members, if you know? I don't remember any family members in the ambulance. If a family member had been with her in the ambulance, is that something that would be noted on the report? No. Generally, if a family member or friend would be with the patient, would they ride in the back with the patient or up front? No, up front, and that might be documented by the ambulance company that a family member rode up front. All right, that will conclude our Q&A practice.